I tell patients that when you're looking at pain after the surgery, remember that I typically will give you local anesthetics at the end of the procedure, so the area will be numb for at least a few hours. So when you're waking up, initially that pain is less perceived, but expect to have pain for the first week, I would say, and I typically give patients stronger pain medications for the first few days, and typically by day 2 or 3 after surgery, they can just switch to non-steroidal anti-inflammatory medications, which I find are not only helpful to manage the pain, but also help reduce the inflammation and the swelling, and are very helpful. After the first week, generally patients can be off the pain medications. One of the teaching points also is that pain that keeps getting worse is not something for you to keep a secret. I need to know about it, as I expect the pain to get exponentially better, especially after that first week. I like to leave a drain after most of these cases and also wrap the penis tightly with what we call a mummy wrap to minimize the chances of blood pooling in the scrotum. But after that, when you go home, it is very important to have a good compressive dressing, a scrotal support that will again keep the scrotum compressed and avoid or minimize at least the possibility of blood pooling there, because if that happens, if the blood pools in the scrotum, which as you know is kind of a sac that can expand and get larger, we simply will have to wait for the body to absorb it. So because of that, I tell patients that it is very important to be vigilant about keeping a good scrotal support for the next 3 to 4 days after the surgery to minimize the chances of that swelling. So obviously we recommend to keep the area clean. When you look at the incision, typically you'll see a glue-like material that I put on the incision. The incision is typically waterproof after 24 hours, and this helps keep it as such for an even longer period. I would say also keeping an ice pack for the first 24 hours is okay and recommended. Beyond that, I don't recommend it, because my experience is that if there is any pooling of blood in the scrotum and you keep using an ice pack, that'll kind of harden the blood, if you would, and make the absorption by the body a slower process. So the main instruction for the incision site is just let it be, keep it clean, and then we'll of course give you instructions about resumption of activities and showering and all of that. So patients can start pulling down on the pump in the scrotum when they are up to it, which is basically when the incision is not hurting as much. In my cases, because I go through a penoscrotal incision and the cut is on the scrotum, this usually doesn't happen until about week 2. Patients who can access the pump away from the incision can do so earlier, but as I said, in most cases, it's about 2 weeks after that, and especially between week 2 and 4 is a time where it's important for them to do this to make sure that the pump sits in the appropriate dependent position in the scrotum. We know that the pain meds, which most patients end up taking for at least the first 2 or 3 days after surgery, can cause constipation. Obviously, minimization of the pain medications is important to lower the chances of constipation. There are medications that we can give to patients, including suppositories that decrease the chances of constipation or relieve the constipation, but also some natural remedies, fruits with fibers, especially pears, can be very, very helpful to minimize this and help the additional discomfort that will come from the constipation. So I generally recommend patients to keep the area dry for 4 days, so no shower in 4 days possible, and tub bath not before 7 days. If there is any opening in the wound, of course, do not do the tub bath until I see you. And as a general rule, I would say showering is better than tub baths in these cases. And in terms of heavy lifting, no heavy lifting for 4 weeks after surgery. Jogging and heavy exercise, same thing. And your body will tell you when you're really up to it, and I will give you a detailed written post-op instructions, but these are important general measures to remember before and after surgery. Patients always ask me, how soon can I drive or return to work? And the answer is different from patient to patient. The one rule that is an absolute is that as long as you are taking any pain pills with narcotics in them, which is only for a few days typically, you cannot drive, obviously. Returning to work, as long as you're not doing heavy lifting, if you're doing desk work, you could do it when you're up to it. Again, typically by 3 to 4 days, some patients are able to do this, but it is different from patient to patient. The recovery period for the surgery, again, can be different from patient to patient. Most patients have pain for about a week and discomfort for another 3 or 4 weeks. I tell most patients that you get to use your device certainly by 6 weeks after the surgery. And again, everybody is different. I've had patients who 2 weeks post-op from surgery, it looks like nothing was done. And then I have patients who even 4 weeks later, they're still somewhat uncomfortable. So it is a little bit different from patient to patient. But I think a 6-week time in terms of expecting when they could use their implant holds in the vast majority of the cases. I typically will give a handout for some of the changes to expect, things that you need to call us for. High fever, chills, shakes, we need to know about any increased redness around the incision, new swelling, pain that is getting worse. And certainly if you ever see any kind of discharge, purulent discharge from the wound, which we hopefully will never see, but if that happens, I need to know about it. I usually see the patients 2 weeks after surgery for their first post-op check. Of course, if there are any concerns or the patient is worried, they could come in sooner. I see them at about 2 weeks after the surgery, and then 2 weeks later when I will teach them how to use the pump. And then if needed, they come for a third visit, and that's their last clearance, which can be 2 weeks later. But in general, weeks 2 and week 4 after surgery are 2 routine appointments. Patients often ask, how soon can I use the device? And the answer is, it's different from patient to patient. Most patients can use a device by week 4, but I recommend waiting 6 weeks. So the safe answer is 6 weeks in the vast majority of cases. For the immediate postoperative period, when you leave the hospital, you will get instructions before discharge as to where to call. And of course, you can always call the office, and the nurses will address the questions and issues to me, or if there are simple questions, they can address it themselves, and you will always have a resource and a place to call.